Hi everyone, this is the third lecture of topic 5, continuing with skeletal system. In this lecture, we are going to start learning about the different bones of the human skeleton. Now if you remember, human skeleton has a total of 206 bones, and we are going to learn about these 206 bones under two subdivisions. The axial skeleton, which is made up of 80 bones, and the appendicular skeleton, which is made up of 126 bones. So the axial skeleton bones are present in the longitudinal axis of the body, okay, and there are a total of 80 bones. We're going to learn about these bones in three parts. The first part is skull, which has 22 bones. It also has a hyoid bone and 6 bones in the ear, known as the auditory ear ossicles. In the second part, we're going to learn about 26 bones in the vertebral column. And in the third part, we're going to learn about 25 bones in the chest region or in the bony thorax. The figure gives you the anterior and the posterior view of the human skeleton. The axial skeleton is shown in greenish blue color, while the appendicular skeleton is shown in off-white to light brown color. We will start with the skull bones. There are 22 bones in the skull, and there are two sets of bones here, cranial and facial, and these bones are joined by special joints known as sutures. The 8 bones in the cranium are, there is one ethmoid bone, one frontal bone, one occipital bone, 2 parietal, 2 temporal, and 1 sphenoid bone. There are 14 facial bones. The 14 facial bones include 1 each of mandible and vomer, and 2 each of inferior nasal conchae, lacrimal bones, maxillae, nasal bones, palatine bones, and the zygomatic bones. Out of this, only the mandible, which is the lower jaw bone, is attached by a freely movable joint. The maxillae are the upper jaw bones. Remember, max wax. The next 4 slides give you different views of the cranial and the facial bones, and we are going to learn more about it when we do the lab. Paranasal sinuses. A sinus means a hollow or an empty space, and there are hollow spaces around the nasal cavity. We have 4 paranasal sinuses. These are the frontal sinus, the ethmoid sinus, sphenoidal sinus, and maxillary sinus. The function of these sinuses is to keep the weight of the skull light. It also provides resonance and amplification to your voice. So that's why when a person has cold and cough and there is mucus in the paranasal sinuses, the voice sounds different. This is another view of the paranasal sinuses. The hyoid bone is unique as it is the only bone that does not form joints or it does not articulate with another bone. This serves as a base or a foundation for the tongue, and the foundation is movable. It functions in swallowing and also in speech. Have you noticed how babies' heads look enormous? This is because the fetal skull is about 1/4 the body length as compared to the adult skull, which is 1/8 the body length. So the fetal skull is really large compared to the baby's total body length. Also, another difference is the presence of fontanelles, which are fibrous membranes that connect the cranial bones. The fontanelles have 2 functions. First, they allow the skull to get compressed during childbirth. If not, the skull would get crushed. And the second function is these fontanelles allow the brain to grow in size during the final stages of pregnancy and also in early infancy. By the time the baby is 2 years old, all the fontanelles, they convert or they are ossified into bone. This figure shows you the anterior, posterior, mastoid and sphenoidal fontanelles in the fetal skull. The vertebral column present on the dorsal side of the body is made up of individual units known as vertebrae. There are 24 single vertebrae which are separated by intervertebral discs, and also two fused bones, we call them composite bones. The single vertebrae include 7 vertebrae which are present in the cervical region, so they are known as cervical vertebrae, 12 thoracic vertebrae present in the chest region, and 5 lumbar vertebrae in the lower back. You may remember this as breakfast at 7, lunch at 12, and dinner at 5. Now the composite bones are made by the fusion of individual vertebrae. 9 vertebrae fuse to form 2 of these composite bones. The sacrum is made up of 5 fused vertebrae and the coccyx made up of 4 fused vertebrae. The figure shows you the different vertebrae in the vertebral column. You can see the 7 cervical vertebrae, 12 thoracic, and 5 lumbar vertebrae. Also, on the bottom of the figure, you see the 5 fused vertebrae making the sacral bone and 4 vertebrae fusing to form the coccyx. The first and the second cervical vertebrae are special, and so they are given special names. The first cervical vertebra is called atlas, while the second one is known as axis. The human vertebral column is not straight. It has curvatures. There are two types of curvatures. Primary curvatures are something that you are born with, while secondary curvatures are developed after birth. The primary curvatures are in the thoracic and the sacral regions, while the secondary curvatures are in the cervical and the lumbar regions. The primary curvatures form an S-shaped curvature. That means it convexes posteriorly, as in newborns, while the secondary curvature actually gives you an S-shaped curvature where there is also an anterior convexing. You can see this in adults. This figure shows you the primary C-shaped curvature of the newborns. This figure shows you both the primary and secondary curvatures as seen in an adult human vertebral column. You see in the cervical and the lumbar region, the vertebral column convexes anteriorly, while in the thoracic and the sacral region, the vertebral column convexes posteriorly. So an adult human being would have an S-shaped curvature. The vertebrae in one region of the vertebral column differ from vertebrae in another region. However, nearly all vertebrae share certain general features which are visible in the typical vertebra shown in the figure. All vertebrae possess a small block-like body which is anteriorly located. Above the body is an opening called the vertebral foramen, which is centrally located. Through this vertebral foramen, the spinal cord passes. The vertebral foramen is enclosed by the vertebral arch, and the vertebral arch is created by two structures, the pedicel and the lamina. On the sides, there are two projections known as transverse processes. Posteriorly, there is another projection called the spinous process, and there are some more processes known as the superior and the inferior processes that help in articulation. Let's start with the anatomy of each region of the vertebral column. We will do the cervical vertebrae first. The cervical vertebrae have holes in their transverse process, which are known as the transverse foramina. Also, the spinous process, which is present posteriorly, is bifurcated or forked, and the first two cervical vertebrae have unique features, so they are named differently. The 7 cervical vertebrae are denoted by the letter C, so it goes from C1 through C7. The first cervical vertebra is known as the atlas, and this has the important job of articulating with the skull bone, more specifically with the occipital condyles of the occipital bone. In the atlas, there is no body, no spinous process, but a large vertebral foramen. Now coming to the second cervical vertebra, C2, it is known as axis, and this has a superior projection which is known as dens or the odontoid process, and this fits inside the C1, which is the atlas. So this joint is known as the atlantoaxial joint, and this allows for you to rotate your head. That means your ability to say no is because of this joint. There are 12 vertebrae in the thoracic region. These are denoted by T1 through T12. A unique feature in these vertebrae is that they have two facets, the costal facets, that help in articulation with ribs. The spinous process is really thin. the vertebral foramen is small, circular, and some people think that the thoracic vertebra looks like a giraffe from the posterolateral side. There are 5 lumbar vertebrae denoted by L1 through L5. The body of these vertebrae is large, block-like. The spinous process is quite thick and the vertebral foramen is more triangular. Some people think that this particular vertebra looks like a moose from the posterolateral side. The sacrum and the coccyx are the composite bones. The sacrum is formed by the fusion of 5 vertebrae, while the coccyx by the fusion of 4. The coccyx is also known as the tailbone or the remnant of the tail, and the coccyx articulates anteriorly with the sacrum. In the figure, you can see the fused spinous processes of the vertebrae on the sacrum's posterior side as the median sacral crest. The inferior bundle of the spinal nerve roots pass from the vertebral foramen of the 5th lumbar vertebra into the sacral canal. The remainder of the axial skeleton consists of the bones of the thoracic cavity that include the sternum, the ribs, and the hyoid bone in the neck. The bones in the thorax form a cage-like structure to protect the internal organs such as the lungs and the heart. This cage consists of 3 parts. First is the breastbone known as the sternum, which is present on the ventral side of the body. Then there are 12 pairs of ribs, and posteriorly it consists of the thoracic vertebrae, which we have already covered in the previous slides. The sternum is the central bone of the thorax and it is divided into 3 parts: the superior manubrium, the middle body, and the inferior xiphoid process. It is the body of the sternum that you compress during CPR and the xiphoid process that you ideally must take care not to break. There are 12 pairs of ribs and the spaces between the ribs are known as intercostal spaces. These spaces contain muscles, blood vessels, nerves, and lymphatic vessels. Ribs articulate anteriorly with the sternum via the costal cartilage. Ribs are classified according to the structure of this costal cartilage. Ribs 1 through 7 are known to be true ribs because they attach directly to the sternum by their own costal cartilage. Ribs 8 through 10 are classified as false ribs because they do not directly attach to the sternum. In fact, they attach to the sternum via the cartilage of the true ribs. The last 2 pairs, that means ribs 11 through 12, are often called floating ribs because they lack any attachment to the sternum. This figure shows the bones in the thorax region. You can see the sternum, the ribs, and the thoracic vertebrae posteriorly.